30% of them are going to be completely asymptomatic or not have any symptoms at all. So we know from this disease that there's a significant population of people that we believe have been infected with the COVID virus based on our modeling. Again, about 30% will remain asymptomatic, but they will continue to spread the virus, and so that's one of the challenges that we have with that asymptomatic population. And so that's why it's, again, very important that we practice all of our social distancing, all of our hand washing, keeping surfaces clean, all of those different things, because it's difficult to tell who is infected and who isn't just based on those symptoms. You also heard me talk a little bit about what our models are showing for total numbers of infected that we expect at the peak. And you heard me talk about anywhere from 1,300 up to more than 3,000. And again, those are contained within that 80,000 population. And so there will be a certain percentage of them, it's usually around 15 to 20%, that are going to require hospitalization. And our model is showing that that number could be anywhere from 1,300 up to 3,000 at the peak. And so that isn't new every day, that's accumulating over time. So at the peak, it would be 1,300 to 3,000 that require hospitalization. So that sort of, again, reinforces the idea that we believe that a surge is coming based on our models. And the only way that we can slow this surge down or make it so that our healthcare systems can handle the surge in patients more appropriately, as well as take care of those other patients that will still show up to the hospital, is to decrease the number of people that become infected. And you've heard me say this over and over again, that's really up to the community on how well we respond to that. And that's following all of the social distancing rules, washing hands, keeping surfaces clean, all of those things that we need to do to keep that number manageable, to keep each other well, and to save lives. Now let me move forward with 6 today. The number of patients in the intensive care units have increased from 224 to 239. And the number of patients now requiring ventilators has increased from 172 to 186. And again, these numbers are fairly consistent with the proportions or the percentages that we've seen of our patients. 70% of those that get admitted to the intensive care unit are ultimately going to need a ventilator. Now, again, I don't want us to focus on numbers moving from day to day. We want to look at trends. And so I know there's always people want to look from day to day, but really we need to start looking at trends and see how our rules, or how are the social distancing and hand washing, how are those impacting the trends. And so those are the numbers that we have today. But we believe that the work that's going on in the region with promoting all of those preventive measures are having an impact. And so that's encouraging, but we also know that we're still on that steep part of the curve, and we need to continue doing everything that we can to slow the spread. So as a task force, we're going to continue to monitor the situation and the resources and look for resources to respond to it. And so that's an update on the numbers that we have today, and we'd be happy to respond to any questions that you might have.
Dr. Garza, I'll now read to you some of the questions that we've received from members of the media, either through email to the public information contacts or via our Facebook page.
Mm-hmm.
And I would remind members of the media, if you do have questions, You can email those during the course of this Q&A period to the Task Force Public Information contacts, and we will read those to Dr. Garza during the live stream. Dr. Garza, the first question. We saw our biggest jump yet overnight in St. Louis County, up 10 cases to 24. Is there a larger explanation as to why such a dramatic jump?
So I want to make sure I understand the data that we're talking about. So are we talking about the number of positives that have been tested, or are we talking about number of hospitalized patients?
That would be, I believe, based on the question, they're talking about the number of tests.
The number of tests, okay. And so, it's challenging to give a definitive answer to that. And so the reason for that is it could be any of a number of things. So it could be we just performed more tests on any particular day. And understanding that a certain percentage of those tests are going to be positive. And that's going to influence, that total number that comes out at the end of the day. And I hope I interpreted that question correctly.
Thank you. Next question. Is the data that you're sharing about hospitalizations, ICU, ventilator use, available online from the task force?
Yes, it's available on the website. So we post the slides every day on the website.
Next question. Do you know if the health systems are running models including patients from rural areas that lack hospitals who will come to the St. Louis area for care? Rural hospital closures mean that the St. Louis region will be carrying the burden for a lot of the state, not just for the region itself.
Right. So the question is absolutely right. There's been a lot of rural hospital closures, especially here recently, and so they won't be available to take care of those types of patients. So let me go back then to the task force or to the statistical area that we look at. And so as you can see, it does encompass some of the more outlying areas. But when we're drawing the boundaries for doing the modeling, this is the area that we're looking at, is the metropolitan statistical area for St. Louis. Now, clearly, they're absolutely right that a lot of the patients from the rural areas will be coming to St. Louis to get care, and so we will capture them in our daily statistics. But the modeling, so there's two separate pieces of data. One is the modeling data, which you see here, and that's the population that includes. The population that I report on every day on the slides is the population that's within the healthcare systems, which can include people from outside of this area.
Do you have any timeline on when the area will receive enough coronavirus tests to adequately address the pandemic in the way that countries like South Korea have done?
Yeah, difficult question to answer. So as I mentioned earlier, it's not just unique to St. Louis. Every community across the country has a shortage of testing kits. So testing is a little bit challenging. So we run tests within our facilities, and then there's also private labs that run tests as well. And neither of them have adequate supplies to do what's called epidemiological testing kits to have a significant impact on that epidemiological surveillance. And so we haven't seen anything or heard of anything that says there's going to be a surge in testing kits coming down the pipeline. We monitor the number of tests that we have every day. Because of the shortage of testing materials, we focus on high priority needs, and those are people where it makes a clinical decision, and healthcare and frontline workers if they're symptomatic. And then there's a certain percentage that we can use for community testing and for surveillance, but it's challenging because we're dependent upon the supply chain. And if the supply chain can't fill those orders, then we're very limited on the amount of community testing that we can do.
How many tests do task force members have currently, and how many are you expecting? And from what sources do those tests come, such as the federal government, state governments, or commercial providers?
Yeah, and so on any given day, there's a different number of test kits available, and then the number of testing that we do. So think about it this way. There's really three different ways. So the first way is really for our ambulatory patients. So those are people that have minimal symptoms, fever, coughs, things like that, who have spoken to their primary care physician, gone online, something along those lines, and then have requested, or their physician or care provider has said, yes, let's go ahead and get the test. So those are people that are primarily done through private labs. And so those are places like LabCorp and Quest. And so those are people that don't have to be hospitalized, things like that. The second group are patients that show up at our facilities. So either in our emergency departments, or they get admitted to the hospital in our intensive care units. And those patients are tested by labs that we have within our healthcare systems. And so that's sort of a separate group of patients, and we can usually turn those results around within the same day. And then the third group that was mentioned is the state lab. And so early on, they were the only lab that was available to do the testing, and that's because they're a resource for the Centers for Disease Control. And they have very strict guidelines on who they do testing on, which, it limited the amount of community testing that we could do. And right now they have prioritized the testing that they will do for first responders, and I believe some healthcare workers. So those are sort of the three buckets. The amount of testing ebbs and flows every day. As I mentioned, it is the supply chain really hasn't kept up with
the modeling address, and how broad is that area?
Right, and so as you can see, the map behind me, that is the counties that are included in the model. So again, it's a fairly well-defined way that statisticians look at data for metropolitan areas, and so this is something that's fairly standard, depending upon which city you're in. So a Chicago will have a Chicago metropolitan area, and this is St. Louis's, and it includes these counties. So when we're talking about modeling for this county, we include this entire population in there, and it's around 2.8 million people. And then when we run the models, the results that we get out of it are generalized across the MSA as well.
Is the 80,000 figure the total number of people who will test positive, or is that a projection, or does it account for lack of testing?
It does account for lack of testing. So again, this is modeling. So this is a prediction of what we believe the number of cases will be, or the number of people that will have been infected with the coronavirus. It doesn't represent.
You have been listening to Dr. Alex Garza of the St. Louis Metropolitan Pandemic Task Force. We will, of course, have the latest information on KSDK.com, the KSDK app, and on air at 4, 5, 6, and 10. We now return you to the Ellen DeGeneres Show.